Hello, dear aspirants. Welcome everyone to the Master Nursing classes. So, in this Wildfire series number 3, the series is completely focused on the crackings of the RRB Nursing Superintendent exams, NORCET8 exams, and ESSC Nursing Officer exams. That is called in your CRE examinations. So, this series contains those very important topics, concept, and the questions that is repeatedly asking in the exams, and the questions that it definitely strikes in your exams. The series is containing the lots of the concept, knowledge, clear explanation in very less times, students gaining the more knowledge. So that is the specialty of the master nursing classes. There is no any faltu byte inside the class. Okay, so here we are delivering the very important concept. Very good evening, beta. Good evening. Welcome once again to master nursing classes family. Yes, if anyone is new to the session, if anyone is new to our MNC classes, so do subscribe to the channel and hit the like button, and you have to press to the bell button, so you will be get notified for each and every classes. Okay, the notification will come for each and every class. Even if I posted some important questions on the YouTube, so it will be notified for you if you are pressing the bell button. Okay, yes, so don't forget to press the bell button, bacho. So it is very important for you all to get notified related to the classes. Yes, so in the last previous class we have discussed the very important questions, concepts, that is related to the autonomic dysreflexia. Everything related to the autonomic dysreflexia we have discussed. That is the clinical scenario, level of injury, the clinical manifestations, risk factors, and nursing interventions related to the autonomic dysreflexia we have discussed. We have discussed related to the MMRC or dyspnea scale. Okay, so that is the Modified Medical Research Council dyspnea scale. We have discussed all the grading of the difficulty in the respiration, that is the dyspnea. Yes, we have discussed in the last previous class. And very importantly, we have discussed also related to the sign of the good attachment. Okay, so it is very important to understand everything related to the breastfeeding. So I have explained sign of the good attachment in the last previous class. Okay, that is to the scenario based questions. So in the today's class also, you people will be getting the some questions that may require the calculation, that may require the background knowledge to solve the questions, and questions also including the, yes, very importantly, knowledge, necessities, and skills. Yes, very good evening, beta. Welcome once again. So if everyone is okay, we'll start the today's class. Can we start the today's class, bacho? Yes, very nice of you all. Okay, so very good evening once again to everyone, and welcome everyone to the master nursing classes. So before going to the main class, here is the beautiful motivational quote in front of you all. That is, your positive action combined with the positive thinking results in the success. Bacho, so success is not a one day output. It is the output of the every successful day. So the day, if you are started early in the morning with the MCQ practices, theory revision, watching the video classes on the important classes. So this is a inclusion of the every each and every successful days. So the collection of the successful days, it will give you a perfect result. Okay, so for that one, you have to be positive, you have to think positive, you have to be with the people who can say some positive words to you all. Okay, so don't connect it with the negative people who are always like teasing you, who is always pulling you down. So avoid those kind of the people during the exam period. Always stay focused, stay motivated, and keep practicing. The everything will be possible what you are thinking, and you become one day. And the day is not for students, that is very near. So you people are having the very golden opportunities in the three successive exams, that is the RRB, NORCET8, and CRE. So I want everyone to get selected in every exams. Okay, so keep practicing the things, keep learning the good things and concept, that will definitely help you in the exams, bacho. Okay, so here is the first question of the today's class. Yes, do read the question perfectly, carefully, then try to give the best answer. This question repeatedly asking in your NORCET exams. Okay, that may strikes in your upcoming ESSC exams also. Okay, so very simple and important question, so that requires some background knowledge to solve the question. Okay, the question is very simple. That is the using the Holidays Segar formula. Okay, by using the Holidays and Segar formula, how much maintenance fluid is required per day for a child weighing the 15 kg. Okay, so this is the simple question. Okay, in the questions they will give the how much kg the child is. You have to tell how much maintenance fluid is required for 1 day for that particular child. Okay, so if anyone knows the answer, yes, do comment in the comment box. I am waiting for your answer. Yes, according to holidays and Segar formula, what is the requirement of the fluid that is necessary for the 15 kg child? Option A is 1500 ml, option B is 1250 ml, then option C is telling the 1700 ml, and option D is telling that is 1800 ml. Yes, so who all are giving the option B as a correct answer? That is the correct answer. I will tell the explanation and rationale why this is the correct answer. Can we calculate? Yes, we will calculate. So here is the basic rules of the holidays and Segar formula based on the weight. Okay, based on the weight. If the baby or if any person who is weighing the 15 kg, so we have to divide this one as a first 10 kg, then next 10 kg, then next more than 10, 20 kg. Okay, then more than 20 kg. So this is the basic division of the holidays and Sagar formula. Okay, so 10 kg, 10 kg, and more than 20 kg. So first 10 kg is we are considering the fluid which is required, that is 100 ml per kg per day. Then for next 10 kg we are requiring 50 ml per kg per day. If more than 20 kg we requires, that is 20 ml per kg per day. It is very simple, bachcho. I will tell how. So here it is 15 kg, means we will divide this one as a 10 kg plus 5 kg. Okay, so as I told, for first 10 kg we require how much fluid? For first 10 kg we required, that is 100 ml per kg. Okay, so per kg 100 ml means for 10 kg how much ml it is? Yes, for 1 ml, for 1 kg it is 100 ml. For 10 kg it is 1000 ml. Very simple. Yes, it is 1000 ml. For next 10 kg, how much it is? That is the 50 ml per kg. So in the next 10 kg, the baby is 5 kg here. They are given 15 kg, that is the 10 kg plus 5 kg. Yes. So for the next 5 kg, yes, we have to consider that is the 50 ml into 5 kg. Okay, how much it is? It is 250 ml. Yes, so 50,000 ml plus 250 ml is the 1250 ml. So hope the concept is clear. So this is how we have to calculate the, yes, our holidays and Sagar formula. Okay, so now same I will give one example, so you people have to solve this one. Okay, so the person is of the, yes, 25 kg. So according, by using the holidays and Sagar formula, tell me the how much amount of the fluid required for this person. Okay, per day. The person is 25 kg. Now the question is how much fluid is required for this person for 1 day. Yes, again same formula. Okay, so here 25 kg means we will divide this one 10 kg plus 10 kg plus 5 kg. Yes, so this is the 25 kg, right? So for first 10 kg, that is 100 ml per kg. Then for next 10 kg it is again 50 ml per kg. Then after 20 kg, that is 20 ml per kg. This is the simple. Okay, so for first 10 kg it is 100 ml per kg, means it is 1000 ml, right? For next 10 kg it is 50 ml per kg, means it is 500 ml. Then after 20 kg, the amount required of the amount of the fluid required is 20 ml per kg, means yes, 5 to the 10, and again 0 to 0, that is the 100 ml. Yes, clear bachcho? So we will make sum of this one, that is the 1000 plus 500, 1500 plus 100, that is the 1600 ml of the fluid required for that person for 1 day. Okay, this is how the holidays and Sagar formula is used. So this question they have asked repeatedly in the last NORCET exams. So it will be very helpful. Okay, so how much they have given the weight, we have to divide that one first 10 kg, next 10 kg, and more than 20 kg. So based on that one, we have to allot the fluid volume. Okay, for the first 10 kg of the baby body weight, that is 100 ml per kg per day. For next 10 kg, that is 50 ml per kg per day, and yes, any weight more than 20 kg, that is the 20 ml per kg per day. Okay, this is the basic fundamental rules of the holidays in Segar formula. So as per our calculation for 15 kg, okay, so the answer is that is the 1015 kg, that is for the 250 ml plus 1000 ml, that is the 1250 ml is our answer here. Okay, yes, this is the correct answer. Hope the concept is very much clear for the holidays in Segar formula. Yes, bachcho, this question again they will ask in your exams. Again, I will bring this screenshot in front of you all after the exams. Yes, I have told you already before the exams. So it is up to you people whether you people want to practice, otherwise leave it. Okay. Yes, it is very important from my side to you all. Okay. Yes. So here is the next question, and very important and most important questions. So as I told, today's session is containing the scenario based question, practical question, and everything that is EMC required. Okay, and ESIC required. Yes, the question is very simple, bacho. So read the question carefully, completely, and give the best answer for this question. Okay, the question is very simple. There is a 28-year-old pregnant woman has been prescribed iron supplementation. Yes, to manage her iron deficiency anemia. After taking the prescribed iron supplementation for 2 weeks, she notices a changes in her color of the stool. So what happens? The 28-year pregnant woman is there. For her, iron supplementation is given to treat her anemia. So she takes the iron supplementation for 2 weeks, and after that she notices that some changes in the colors of her stool. Okay, and she become worried about that one, and she wants to consult the doctor about it. Then the question is, what is the most likely cause for change in the stool color in this patient? Okay, so why the color of the stool has been changed in this particular patient? Yes, option A is telling that the iron supplementation have caused the gastrointestinal bleeding. Here, the iron supplementation what we have given, it is they told it is causing the GI bleeding, so that's what the color of the stool is black in color. It is not correct, bacho. So iron never ever causes the GI bleeding. Yes, I am eliminating the option A. Then comes to the option B. The iron supplementation are causing stool to turn dark green due to the increased bile secretion. There is no relation between the iron and increased bile secretion. Yes, if you are having the fat-rich diet, then there may be chance of the increased bile secretion. If you are having iron-rich diet, there is no any increase in the bile secretion, bacha. Okay, so that is normal bile only secret, and there is no contribution of the bile in the change in the color of the stool in the iron who is the patient who is taking the iron. Yes, so I am eliminating option B also. Then come to the option C. The iron supplementation have caused the stool to turn black or dark green, which is normal. Yes, this is the correct answer. But you remember, whatever the iron we are giving, that is trying to eliminating from the GI tract. So it is mixed with the stool, and the iron which is mixed with the stool, which turns the stool to turn black and dark green in color. Okay, so which is normal side effect, nothing to worry. We have to educate the female, so no need to worry about it one. It is the normal expected outcome of the iron supplementation. Okay, so this is what we have to teach to the patient who is taking a iron supplementation. Okay, one more scenario based questions that may they create in the exams based on this one. So the questions will come like this also. How means, yes, you are a nursing officer assisting a mother of the anemia child. The child is on the iron supplementation therapy since from last 2 weeks. When mother takes a child to the washroom and she notices that the child stool is coming dark in color, and child asks you, the mother will ask you why the color of the stool is become dark in color for my child. She will ask like that. So at that point of the time, as a nursing officer, you people have to educate. Your baby is on iron supplementation, your child is on iron supplementation. Yes, it is a normal expected outcome, that is dark color stool, and constipation is the normal expected outcome of the iron supplementation therapy. Okay, so there are lots of the questions they may create on the iron supplementation. It is very important. We have to give the iron IV also, IM also we can give, and oral also we can give. Okay, so for oral medications we'll give the iron with the like citric acids, like fruit juice of which is containing the citric acids, like for example lemon juice and orange juice. So along with this one we can give, because this citric acids which increases the absorption of the iron. Okay, so very importantly, and never ever give calcium and iron together. Okay, so there is situation in the pregnancy after second trimester we have to give the iron also and calcium also to the pregnant woman. Okay, iron we are giving to reduce the dimorphic anemia, and calcium we have to give to reduce the back pain and to increase the supplementation of the calcium in the pregnancy. So there is situation we have to give the calcium also, iron also. Yes, at least 4 hour gap we should maintain between the iron and calcium, because calcium binds the iron and calcium decreases the absorption of the iron. Okay, so iron and calcium never ever be given together. One more important point: while giving the oral iron we have to give with the citrus fruit. While giving the iron, don't give with the calcium. And while giving the iron, don't give with the milk product and dairy product. Why I am telling like this? Why means, again, the milk containing the calcium, the milk products containing the calcium, and the dairy product containing the calcium. So you are giving the iron with calcium, again the absorption will decreases. Don't give with calcium, don't give with milk product and dairy product. Yes, clear. So iron, for absorption of the iron, the HCl is very much required. The hydrochloric acid which is secreting normally in our stomach is very necessarily required. So don't give the proton pump inhibitors and iron together. You are giving the injection pant up at 6 o'clock, and you are giving the iron supplementation at the 7 o'clock. There is no use of the iron. Okay, so don't give the PPI, that is proton pump inhibitors, or H2 receptor blockers and this one iron together. Why? Because the HCl is required. You are giving the PPI, means it reduces the production of the HCl. You are giving the H2 receptor blockers, that is the ranitidine, Rantac, okay, sementidine, famotidine. So these are the medicines which are called H2 receptor blockers, pantoprazole, omeprazole. Okay, these are the proton pump inhibitors. So these medicines decreases the production of the HCl. So you are giving the iron and medicine which decreases the HCl together, means the absorption of the iron will, and again she will comes to your OPD after the 3 month, 4 month, that is again with the fatigue and other symptom of the anemia, because the anemia is not cured, because of this some one minor education we are unable to give. So because of that the problem still like this only. So the wastage of the medicine, wastage of the time, and wastage of the, yes, everything. Okay, that is the very much necessary. Don't give iron with the proton pump inhibitors, don't give iron with the calcium, don't give iron with the like milk product and dairy product. Don't give iron with the coffee, tea and all, because coffee, tea again it contains the milk. Okay, so these may the scenario based questions they can ask. And the stool of the iron, the stool of the woman after giving the iron becomes normally dark in color. So this one we have to explain to a mother who is taking the iron supplementation. Okay, and don't forget to give iron with the citrus fruit. Okay, so always give the iron with the citrus juice that is containing the, yes, vitamin C, and it increases the absorption of the iron. Okay, so that is the very basic and important thing that you people have to know. Okay, so before going your exams, what are the bullet points comes from my side? This is your rank deciding points, bachcho. So note it down. I have repeated everything 2 times because it should and must penetrate your brain, and it should be remembered till your exams. Okay, so is this clear? Yes. So here is the next question in front of you all. So before going to the next question, this is the basic thing you people have to know to control the negative marks, to bring your rank in the top hundreds. You have to practice the best test qualities. Okay, so best quality test you people have to practice. Where you people will get the best quality test? You people will get the best quality test series in the master nursing classes application with the name of the sure selection test. The sure selection test, which is are prepared by the expert AIMS nursing officers, the subject wise expert peoples, they are preparing the notes, they are preparing the rationales, they are preparing the questions for you all that may definitely strikes in your exams. Okay, so this particular series, sure selection test series, is completely focused over the RRB nursing superintendent exam, NORCET8 exams, and CRE ESIC exams, including the non-nursing, nursing, everything. Okay, and that may definitely strikes the questions. Okay, all updated questions we are bringing in front of you all. So if you are interested, so do download our master nursing classes application. The link is there in the description box. Okay, so still you people have any doubt related to the sure selection test series, you people can contact the number given below here. Okay, that is the 8296554687. Okay, so this is the number of our relationship manager. So he will be always in contact with you. He will guide you how to give the test series and everything. So if you people are interested, do contact him. So note down the number, that is the 8296554687. Okay, so this is the single solution for all the exams that you people are going to face in the next 3 months. Okay, so here is the next question, and very important question. Yes, which of the following best describes the word evolution in the schizophrenia? So simple, the question is asking the meaning of the evolution. Okay, yes, if anyone wants to give the answer for this one, so do give in the comment box. Option A, that is the evolution meaning excessive movement. No, excessive movement, it means that is the hyperkinesia. Yes, hyper means more, kinesia means movement. Okay, excessive movement, or we can say hyperkinesia. Okay, so this is not in meaning of the evolution. Then auditory hallucination. What is the hallucination? What is the illusion, bacho? Yes, hallucination is a problem of the perception where the person will perceive the sound, okay, without any external stimuli. If with external stimuli we say this is the illusion, consider, okay, so this is the pen, I am saying this one as a gun. So this is the pen which is present. Okay, external stimuli is present. So after watching this pen, I am saying this is the gun, or I am saying this is a knife. Okay, this is not a gun or knife, this is actually a pen. So I am falsely interpreting the things, means that is the illusion. Okay, so pen is not there, nothing is there, I am saying that. So there is floating pen in front of me, so that is visual hallucination. Okay, I am saying that I am hearing the voice of the Narendra Modi who is there in the Delhi. I am there in the Kolkata. Okay, so I am in Kolkata. Yes, Narendra Modi in the Delhi. I am in Bangalore. Narendra Modi in the Delhi. I am in Hyderabad. Narendra Modi in the Delhi. So I am hearing the sound of the Narendra Modi. Okay, but there is no external stimulus. Still, I am hearing the sound. Without external stimuli, I am hearing something. Means that is the auditory hallucination. Okay, so without any touch sensation, I am feeling the, yes, the touch sensation over my skin, that is the tactile hallucination. Without any smells, I am feeling the smell, means that is the, yes, olfactory hallucination. And without any taste, I am feeling the taste, means that is what we call, yes, gustatory hallucination. Okay, so these are the hallucination are the perceptory conditions. Okay, so disorder of the perception where we are observing the things without any external stimuli, that is called as the hallucination. Okay, with external stimuli we are falsely interpreting the things, means that is the illusion. Okay, so the concept is clear. Then comes to the delusion. Okay, so what is the delusion? Delusion is the false fixed belief. Delusion is not a problem of the perception. Yes, delusion is a problem of the thought content where the person is falsely fixed belief. Okay, so he believed false, and which is fixed in his mind, which is not shakeable by the external stimuli. So he will say something that whatever the TV anchor is talking, he is talking about me. That is the, again, delusion. Okay, he is referring himself to the TV anchor. That is the delusion of the reference. And patient is saying, I am having the superpower, I can jump to the sky within a second, he will tell. And he is having the, yes, false fixed belief that he can having the superpower. That is called as the delusion of the grandeur. Okay, so there are lots of the delusion is there. So this is the basic meaning of the delusion. Okay, this is the false fixed belief which is not shakeable by the external stimuli, that is the delusion. Okay, hope the concept is clear related to the illusion, hallucination and delusion. Clear? So then comes to the option B, that is the lack of motivation to initiative. That is what we call as the evolution, and almost all people given the correct answer. So that is the option B goes to the correct answer here. Okay, so that is option B goes to the correct answer. That is lack of motivation to initiate the activities. So there are two words in the psychiatry. you people have to understand there is the evolution and evolution. Volition. Volition means person always take the initiation to do the activities. If you are doing something, he will say, I will do this one, I will finish this one, I can do this one. Okay. Always he will take the initiation. That is the volition. Okay. So evolution stands here as the person he is unable to take the any initiation in any activities. Okay. His lack of the motivation, he don't want to take any initiation. That is called as the lack of motivation to initiate the activities. So that is what we call the evolution. Okay. So evolution, it is very very important. The word it will strikes as a scenario based questions in your exam. So understand the basic meaning of the evolution. That is the lack of initiation in any activities. That is what we call as the evolution. Yes, clear bachcho? Yes, nice of. So here is the next question. So do read the question perfectly, then try to give the best answer for this question. Yes. Which of the following diuretic is the drug of choice in the treatment of the cerebral edema? Almost all you people will give the correct answer. I know, but the question after giving the correct answer I will ask. That is very important for you all. Okay? Yes. Which of the following diuretic is the drug of choice in the treatment of the cerebral edema? In the cerebral edema, which drug we can give as a drug of choice? Option A, that is the sumatriptyline. Option B, that is the mannitol. Option C, that is the furosemide. And option D, that is the acetazolamide. Yes? What is the correct answer? Which of the following is considered as a drug of choice in cerebral edema? Yes, almost all of you have given the correct answer, bacho. So that is mannitol. Okay, mannitol is the osmotic diuretic. So it will pulls the fluid from the brain into the intravascular space. So that is the reason why in the cerebral edema the drug of choice is the mannitol. Okay. So can we give mannitol in the congestive heart failure patient? Is it recommended to give the mannitol in the congestive heart failure patient? Can anyone wants to answer for this one? Yes or no? Can we give? This is a diuretic. Mannitol is a diuretic which increases the urine output. So can we give the congestive mannitol in the congestive heart failure? No, bacho. Okay, you can give all the diuretics, but mannitol is contraindicated in the congestive heart failure. Why? Because the mannitol is the osmotic diuretic. What it means? Osmotic diuretic means. Okay, when we give administer the mannitol inside the vein or the vessel, okay, it will be in the vessel and it increases the concentration in the vessels. Okay, so it increases the osmolality in the vessels. So this osmolality will increase it in the vessels and which pulls the okay, so which pulls the blood from the extravascular space to the intravascular space. Okay, which is pulling the blood means the volume in the blood will suddenly increases. So in the congestive heart failure, already congestion is there in the vessels. Already vessels are overloaded and the heart is overloaded with the blood. So that is what we call the congestive heart failure. So again, after giving the mannitol, it is increasing the congestion in the blood vessels and it is increasing the load on the heart. So never ever give the mannitol in the congestive heart failure patient. It is very very important. Okay. So in the pulmonary edema and congestive heart failure patient, okay, we can't give mannitol. Even if it is a diuretic, we can't give mannitol. Okay, we can give the furosemide, that is the Lasix, the most commonly used diuretic. Okay, so in both pulmonary edema and congestive heart failure, in order to eliminate the fluid from the body, the drug of choice we are using that is furosemide. Okay? So to eliminate the urine or to eliminate the fluid from the body in pulmonary edema and congestive heart failure, the best drug and the drug of choice is the furosemide. Clarity, bachcho? Then the next question is, so what is the drug of choice for the, yes, any problem, bachcho? Any break in the voice? Can anyone please comment? Any break in the voice? Okay. So if anything, our technical team will resolve. So you people don't worry. So stay connected. Yes. So the sumatriptyline is a drug of choice for the. Is it clear, right? Yes, so anyone please comment here. So the voice and the board, everything clarity is the clear, I think. Okay, so the sumatriptan is the drug of choice for the migraine. Okay, so what is migraine? What is migraine, bachcho? Migraine is a kind of the headache which occurs due to the dilation of the blood vessels in the brain. So when the heart pumps means the blood will suddenly goes and which strikes to the brain. The headache will be felt by the person. That is called as the migraine headache. The migraine headache is maybe unilateral or bilateral. So which occurs due because of the cerebral dilation, vasodilation. So where in the cerebral condition of the migraine we want to constrict the vessels in the brain. So that is the sumatriptan used as a drug of choice in the patient with the migraine. Okay, so very importantly, then tell me the which is the drug of choice for the mountain sickness. So what is the drug of choice for the mountain sickness? Yes, the acetazolamide or the diamox, we can say, in the hospitals, in the clinical scenario, in practical scenarios. So the acetazolamide is also called as the diamox. Okay, so diamox or the acetazolamide is the drug of choice where we can use in the mountain sickness. Okay, how it acts as a drug of choice in the mountain sickness, bachcho, where the person will go on over the mountains, so he may get some syncope because in the change in the CSF. Okay, so which mentions the balance of the CSF. Okay, so astazolamide is used as a drug of choice in the mountain sickness. Okay, and astazolamide is also used to reduce the intraocular pressure. Okay, so astazolamide is the diuretic. Okay, so which reduces the amount of the production of the our aqueous humor fluid which is there in our eye. Okay, so that is the astazolamide is also used in the treatment of the glaucoma to reduce the aqueous humor fluid. Okay, so hope the concept is clear on the astazolamide and sumatriptan and mannitol and lasix. Okay, yes. Yes, the most common side effect associated with the pyrazinamide or Lasix is the hypokalemia because it eliminates the potassium. Okay, as a nursing intervention, it is very important for the nursing officer to monitor the potassium level before giving the pyrazinamide. And remember, so always before giving the any Lasix, you as a nursing officer we need to monitor the blood pressure because in the hypotension case we can't give the diuretics because diuretics again reduces the fluid from the body and it may leads to again hypovolemia and hypotension may increases. Okay, in the hypertension we can give them pyrazinamide, but in the hypotension don't give the pyrazinamide or any diuretics. Okay, so it is also very important. So before giving the any diuretics we need to monitor for the blood pressure, and before giving the pyrazinamide we need to monitor for the potassium. Okay, so because pyrazinamide which decreases the potassium level in the blood. Okay, by eliminating the potassium. And so if you are giving the potassium sparing diuretic, that is the spironolactone. Okay, yes, potassium sparing diuretic is the spironolactone, means it eliminates everything but it retains the potassium in the body. So if you are giving the spironolactone, then you have to assess for the hyperkalemia. If you are giving the pyrazinamide diuretic, you have to assess for the hypokalemia. Yes, it is very important. And always administer the diuretics in morning dose and afternoon dose. Don't give the diuretics in the evening and night. Okay, so diuretics should be given before the 5 p.m. Okay, if your doctor advised the pyrazinamide BD, means two times in a day, so first dose should be given early in the morning around 6 to 7 o'clock, and second dose should be given at the 3 to 4 p.m. in the afternoon. So don't give pyrazinamide after the 5 p.m. because pyrazinamide increases the urine output. Okay, if you are giving the pyrazinamide in the evening, so the patient will not sleep over the night. Okay, every 15 minutes, every 20 minutes, every 30 minutes his bladder will get filled. So when his bladder will get filled, he will wake up from the sleep, and he used to go for the washroom continuously throughout the night. So that is the reason don't administer the diuretic at the night time. Okay, so if we the two doses we need to give in a day, so give early in the morning one and in the afternoon one. Don't give at the evening and night. Okay, so hope the concept is clear over the this one. What we can say, pyrazinamide and diuretics and general instructions and nursing management in the diuretics. Okay, so hope the concept is clear here. So this is all about for the today's class. In the tomorrow's class we will again discuss the very important questions. If any issue will be there in the class, I will resolve immediately, so don't need to worry about that one. Yes, so while are practicing the test series, be connected, keep practicing, try to control your negative marks. Okay, so some students consistency, you people scoring more than the 60 score, so this is very much important to remember. So you are always there in the selection rank, okay, selection list, okay, your name will be there in the selection list, but the differentiating thing is your rank. But you are today, you people are top to study means still you people will get 60 marks, okay, you people will get top 1000 rank, but my concern is you people should get top 100 rank. So for that one, still need to work hard. Okay, so one day paper you are getting the above 70, above 65, above 60 marks means don't relax. I am getting the 60, okay, no problem. No, the competition is in next level. Yes, the competition level is increased, so you people still have to work hard. Okay, and who all are getting 40 to 50 marks on consistent day, so still you people have to work 6 hours, more than 6 hours a day. Okay, stay connected with the master nursing classes. What all are the daily questions we are providing, so do read the each and everything rationally. Okay, so definitely those questions only what you people are practicing will be manifesting in your main exams. Okay, yes, so this is all about the today's class. So if you people having any doubts related to the today's class, you people can comment in the comment box. So we'll meet again in the tomorrow's class. Tab tak ke liye, Jai Hind, Jai Bharat. Thank you.